So the topic of discussion is conservative treatment of discolored tooth. As we have four major type of treatment options for the discolored tooth, number one is bleaching. What bleaching actually is, it is the process of lightening the tooth by means of a chemical agent that oxidizes the organic pigment of the tooth. Then we have microabrasion. Then we have micro or macro abrasion. We'll discuss each one of this in detail. Then we have veneers. It is a very common aesthetic procedure happening these days commonly in the clinics. The drawback of this, it is not as permanent. Conservative measures are not as permanent as compared to the placement of the porcelain crowns. And also the good thing about the veneer, it is a conservative treatment, right? As the cutting down a tooth is very less. Conservative treatment. The fourth one is porcelain crowns. Porcelain crown, it is one of the best aesthetic treatment for discolored tooth. It is mostly recommended. Right, these are the four treatment options. We'll tell patients once patient come into our clinic as the complaint of the discolored tooth. So we'll explain patients all these four procedure and let him or her decide which treatment he or she wants on the basis of the conservative approach and on the patient's willing. Right, now we'll discuss the types of discoloration. Types of discoloration. We have two types of discoloration. We have extrinsic discoloration, as the name suggests, outside, outer layer, right? And then we have intrinsic discoloration, as the name suggests, it is in the inner surface, right? It might be of enamel or dentine, right? Now extrinsic in this, the stains resembles the remnants of the nascent membrane, right? Now we'll discuss the factor that causes this extrinsic staining. The factors include poor oral hygiene, number one, and the basic factor, poor oral hygiene. Then we have existing restoration, also contribute this toward this factor. Gingival bleeding, plaque accumulation, then we have eating habits, pan, chewing, cigarettes, tea, and presence of chromogenic organism. These are the factors that contribute towards the extrinsic staining, and the factors that contribute toward the intrinsic staining are the hereditary factor, as it is on the inner layer, hereditary factor, antibiotics or medications that include tetracycline, it can cause due to trauma, prolonged illness in childhood, right, or excess fluoride in water, right? Stains can be on any part of tooth. It might be in the enamel and might be in the dentine. Severity depends upon the duration of severity, exposure, right, and time. This is all for intrinsic, and for the extrinsic, it differs in the young and it differs in the old. In the old patients, it might be present in the black, in the brown, or in the gray, while in the young, stain can be of any color, right? This is all for treatments, options, and the types of discolorations, right? We're going to discuss the bleaching option in detail. What bleaching actually is, it is the lightening process of the tooth by means of a chemical agent that oxidizes the organic pigment of the tooth. What bleaching is, it is a lightening procedure that use the chemical agent that oxidizes the organic pigment, right? This is all for bleaching. Now we have in-office solution. There are two types of bleaching. We have vital bleaching, right, vital bleaching, and we have non-vital bleaching. Vital bleaching include two, home bleaching and in-office bleaching. Vital bleaching include two, home bleaching, and then we have in-office bleaching, right? Bleaching is of two types: vital bleaching and non-vital bleaching. In vital bleaching, we have home bleaching and in office bleaching, right? What is home bleaching? As name suggests, we can do easily it at home. The chemical agent used in home bleaching is carbamide peroxide, that is 10 to 15% carbamide peroxide, right? We take this carbamide peroxide in a soft splint, right, and then wear that splint for 8 hours a day for 2 weeks. Place it in soft splint for 8 hours a day and for 2 weeks. This is all procedure for home bleaching, right? As 10% carbamide peroxide contain 3% hydrogen peroxide. As we already know that the product with 0.1 to 6% hydrogen peroxide should not be used under 18 years of age. This is the precaution, right? Keep this in mind. This is all for the home bleaching. Now go towards the in-office bleaching, right? In in-office bleaching, we use the gel is same as the carbamide peroxide, but it is of high concentration that can cause the tissue burn, right? So the H2O2 hydrogen peroxide used in this is of 25 to 40%. So it is dangerous as the concentration is high. So first of all, we have to give the gingival barrier protection, that is by applying the aura base. Apply aura base at the gingiva. Why? Because the concentration is high, it can damage the gingival tissues. So we'll apply the aura base prior to the treatment of the gingiva and look for a sign of leakage. Now polish the teeth with pumice and then again apply the same procedure and polish the teeth with pumice and avoid coffee, tea and cigarettes. In aura base, then look for the leakage and polish teeth with pumice. And avoid these factors. Avoid coffee, avoid tea, and avoid cigarette, right? Now, other is the non-vital bleaching. Non-vital bleaching. Here we'll discuss the non-vital bleaching, right? What is actually non-vital bleaching? It is also known as walking bleach technique. It is also known as walking bleach technique, right? What in this we'll do, first of all we apply aura base to protect the gingival tissue, then we open the excess cavity and remove the root filling to 2 mm. First of all we have to apply aura base, right, for gingival protection, then remove open the excess cavity. After opening excess cavity, we'll remove the root filling to 2 mm, right? We'll remove root filling to 2 mm below the gingival margin. Then we'll place a thin layer of GIC to prevent the root resorption. While we'll place GIC to prevent root resorption, right? Then we'll remove this root resorption. Then we'll remove the stained dentine within the pulp chamber. Then we'll remove stained dentine within pulp chamber. Place 35% carbamide peroxide as same as material is same but concentration is high, carbamide peroxide, and review after 1 to 2 weeks. And seal the cavity with composite. This is for the walking bleach technique. In walking bleach technique, we use the chemical peroxide, but concentration is high as compared to the home bleaching. We apply aura base for the gingival protection and remove the root, do the excess cavity opening, remove the root funnel, filling to 2 mm. Apply GIC. After applying GIC, we'll remove the soft dentine within the pulp chamber and then place 35% carbamide peroxide and then review this after 1-2 weeks and apply the apply composite on top as a restoration. This is all for the non-vital bleaching, that is also known as walking bleach technique. Keep in mind the material used in all the type of bleaching is the same, that is carbamide peroxide, except the concentrations that are keep on changing.